Right
Here we go.
Easy.
Welcome to Catalyst for Healing. I'm Maria Lloyd, a licensed therapist, and I'm here with Dr. David Richter.
Nice to meet
He
you.
runs the Ketamine Clinic, Renews Ketamine Clinic in Seal Beach, and he has joined our podcast as of recent.
Thank you.
So it's been wonderful to have him on, and we just wanted to take the time today to learn a little bit more about you and your history and what brought you into this field. So we'll just do kind of a interview about, some of your, like, what led you into doing this work.
Well, thank you so much for taking the time. I'm excited to be part of the team. I'll give the abbreviated version because I can talk off forever. But it's been quite the journey, to say the least. I originally actually come from Czech Republic. I grew up there until I was 18, and then I came into the country, came into California actually, as an exchange student. Well, exchange student. It was a program that ran to basically involve students from out of the U.S. Families would team up with this nonprofit organization to be here for a year for basically a first year of college or senior high school year. I finished high school back home in Czech Republic, very different type of upbringing. And I really wanted to, at the time, if there was any way that I could further myself, especially anticipating at the time, that was 2001 actually, because we were anticipating joining the European Union, especially when it comes to English language skills and being able to lay roots anywhere where you would have more opportunities. I mean, if there was any
so I don't even know your history. So tell me, did you grow up learning English, or do you just...
Yeah, that's the second language. So I think everyone has learned as a second language.
But it's still
I studied English, so when I came here, I mean, I remember my first experience. My host family actually landed in Sacramento. I lived there with them for 2 years because then I extended my stay and I stayed for another year on a student visa.
Oh, nice.
I fell in love with it here.
You must have had a good host family too.
What's that?
You must have had a good host family.
They were fantastic. I mean, they were amazing.
Wonderful.
And I owe, that's another thing. I owe everyone that's been in my life here so much. It wouldn't happen without the people that were here. And they've helped me along the way. It's just, you don't live in a vacuum. It would just, none of this would have ever materialized. But they were fantastic people. They have also been doing it for a long time. And I was here with another student. Actually, he was from Ecuador. So we were here with them, staying for 2 years, actually. First, it was just for a year, but coming from totally different parts of the world, we both actually, within the first couple of months, were like, if there's any way we could make it happen to stay here and continue education or anything like that. And they actually helped us being able to do that. They allowed us to actually stay with them. So they were doing this all for free.
Wow.
They were not getting any money from anybody. And they've done it for a long time, 15 years, kids from 20 different countries around the world. And really very giving, very nice people.
What an opportunity.
Yeah.
So what college did you go to when you...
So when I started in Sacramento, actually, it was just a junior college. At that time, I was here. I don't come from some royal family back home. I don't have some incessant financial backing. So I was, as an international student, you have to pay international fees for anything like college.
Yeah.
And those are an incredibly high fees if you look at the tuition or anything like that. Especially for back then, what was the exchange to US to Czech crown, US dollar to Czech crown. At the time, it was an incredible amount of money. And so after the first year, I started to work part-time, actually, with my host dad, basically working a carpenter part-time while going to college part-time. Just doing anything I could to stay here, make enough money for the tuition alone, because they were allowing us to actually stay for free, which was incredible. So I was going into junior college at first, and that's kind of where where all of it started was.
Did you know you wanted to be a doctor at this point?
No.
Or no? Okay.
So coming from back home, my dad is a doctor back home. But and he's very good at what he does. But I think he was an example of the more stereotypical perception of a physician that I've always had. Very very surgically driven, very, and my parents divorced and I grew up with my mom, but in the same town as my dad. So I would
Mm-hmm.
visit, 2 or 3 times a week with my older brother. And he was always an example of a physician that I was not ever anticipating necessarily ever wanting to be as a professional like that. He was incredible when it comes to his craft, without a question. A bedside manner or approach like that, that was something that he never, I feel like, truly developed as much as I wanted to develop. And I learned more about him actually going through experiences in adulthood, as we tend to learn sometimes about our parents, realizing the more of the truth. But that's how I perceived it at the time.
Yeah.
So back then, starting to go through college, bright-eyed in a completely different country, different culture, right? At the time, I wasn't necessarily thinking medicine. Mm-hmm. I always had some interest in sciences, what we call like the more hardcore sciences, like biology sciences and things like that. But that was actually just how I grew up. That's what I've already done back home. I was more focusing on the hardcore sciences, already going that direction. I took it that direction in the junior college, but I got to say, some of the best classes I've taken were not at all science related or what we typically see as hardcore science related. So in that sense, I have an incredible couple of instructors. One of them I took this class by accident because I didn't know how to read the college catalog.
Your English was still struggling at this point.
It was my first year, second semester at the junior college. I took by accident an honors English course. It was an accident. I didn't know. I didn't know two main important things.
Yeah.
I needed this that I needed for credit, but it was the honors version on the second page of the catalog, and it was strange to me that only like one time block was allowed or offered. I was like, all right, that's what I'm going to do.
Yeah.
From back home, very much being driven to just kind of like accept, obey, and go on along with the system, never question anything. And so I signed up for this class immediately in the first class when we started introducing ourselves. I was wrong class. So second mistake that I didn't know is I didn't know you could actually like drop classes, withdraw in the beginning without being penalized for it if you wanted to change the schedule. Right. It's like, all right, this is what
I'm doing.
And it was one of my worst grades, It wasn't bad or anything like that, but it was definitely the hardest class I've taken.
You weren't like thinking in English by this point. I mean, that takes a while.
No, and like that's the thing. I started to by that time because I was here already before that for a year, or I actually did a year of high school here, even though I finished high school there. That was the original part of the program. Okay. And it was more for the English skills, not necessarily for the education itself. Yeah. And that helped a lot. But in the second year, when I started college, it was always, a thesaurus, my own Czech English dictionary. I mean, I have that around me anytime I was typing any essays. Yeah. That was literally my standard. And it was one of the most incredible classes that I've taken. Just being able to like really challenge in a way that I didn't anticipate at all. Met some incredible people and really started to give me an idea of, wait a minute, I can like explore other things than what I've always been set on, which is not medicine, but just some kind of hardcore science. Yeah. Whether it's some kind of a researcher, whatever you're talking about,
you're able to tap into more of the emotional side of your
brain. And like in a seminar style class, where we're discussing things, and it was difficult, but it was incredible. It started opening my eyes. So then later on, I actually took another course along the lines, like an honors history, mainly for the type of discussion that we were leading, not necessarily for the difficulty of it. It was also challenging, but being able to discuss things more in a kind of a seminar style class, instead of just writing necessarily, or just like a multiple choice exam, that was something I never really experienced.
Yeah. So at what point did you decide, or where did you end up going to
school? Junior college, then I transferred once, and that's a long story short, is I went through the whole immigration process. I actually have to credit an incredible family, another family that actually sponsored me for a green card, which was incredible. And that's how I was able to actually get a green card and then go into a 4-year college, because the fees suddenly become a resident fee, and that drops by about 20-fold.
I'm sure.
So international fees are in general about 15 to 20-fold higher.
Wow.
When it comes to the junior college. In a regular college, they're still substantially higher.
Okay.
So once I got my resident status and I transferred to UC Davis, actually, up in Northern
no
California.
way, I went there too.
Yeah, actually, in Justin.
And Justin did. That's hilarious.
We never crossed paths there. We never crossed paths there.
Oh, that's so weird, because I knew you went to medical school together, but I didn't know you went to UC Davis.
When we were there at the same time, but I graduated by the time he was just kind of starting, and I was working in a lab there.
Didn't you love it there?
Yeah, it was super fun. Yeah,
hiking. I just love all the.
So I lived in Sacramento, but I because it's such a short.
So it's short
distance. It was like 20 minutes from where I lived. But in Davis, I was more and more realizing I liked still the hardcore sciences.
Yeah.
I was more and more gearing towards biological sciences. I did microbiology, actually. I was more and more playing with the idea of maybe research, like a PhD, or maybe teaching. Okay. I love teaching because through my various jobs that I've had in order to support myself here, and I've had a lot of jobs. One of the jobs I had that I actually stuck with because I enjoyed it, but it was also well paid on the weekends. I was a motorcycle instructor for 7 years.
Oh, no way.
So
that's cool.
That's another whole can of worms. But I did that for 7 years also to support me through college because we worked on the weekends, the classes. That's when people take the classes. And I could go and be at school Monday through Friday.
Oh, that's great.
And then pick up once in a while shift during the week, like on a Friday, but then work all weekend like that.
Yeah.
So I was thinking maybe teaching because I was enjoying the teaching part of it.
Yeah.
And then more and more I was realizing as I was actually interning like research lab and this and that, I was realizing I still had a lot of aptitudes towards medicine as is. And more I was realizing that interaction with people is what I really enjoy, what I thrive on, bringing me closer and closer to really the inherent work with people, like actually intimately with people, being there, being able to really process and heal with people, whatever you're doing, whether it's surgery, you're still there with the person. So in that sense, I was starting to more and more delve into medicine. And then I finished some courses. And so then I actually did medical school at UC Irvine down here.
Oh,
that's how I transitioned to Southern California. And that's where I met Justin.
I didn't realize that. We call him Justin and David. I know we got to go by your doctor's names.
It's hard for me because we've been such close friends since like the beginning of med school.
That's so awesome.
So it's very different. Like Dr. Yannick, of course, I'm Dr. Richter, Dr. Yannick, but he's just Justin. He's, he's a friend of mine. And, I've known him since he was 22 or 23 years old.
Oh my gosh.
When he started med school,
awesome.
Right? He went
I didn't realize
straight through.
Yeah. He started right at the beginning.
So and more and more in medical school, and we were really close friends. We roomed together. Yeah. That was one place where we shared definitely a lot of things. One of which was let's just explore everything. I mean, that was one of the funnier things. Now that I think about it back, is anybody who goes through medical school feeling like they have the answers to what they want to do with medicine. If you had $1 for that, or I could quit medicine altogether. Yeah. It's very easy to go with preconceived notions and then be proven wrong completely. So we just told ourselves, at the time I was playing with the idea of surgery. I liked kind of the mechanical work of being able to do something with my hands, the surgical procedures. I, enjoyed procedures whenever I was doing them. But at the same time, exploring everything and trying to keep an open mind. And we really did. One of the best rotations I've had was my psychiatry rotation.
Interesting.
And both me and him were very much on board to also explore that. For a while, we were thinking that that's the field we'll go into primarily.
Oh, really?
Yeah.
I didn't know that.
Yeah, I did 2 rotations. It was like a general adult psychiatry, and then it was 3 weeks, and then 3 weeks of pediatrics psychiatry, which I really enjoyed. That was something that at the time, coming from parents that divorced, growing up in communism for my first 6 years of life. Not that I remember much from it, but it doesn't change overnight. The reverberations of it pertain in a society that's generations
from
right?
That?
I think the main difference that I was contrasting to life here was kind of any kind of free will in a sense of choices when it comes to outside of the system of what you were kind of coined and made to be more. Yeah. So perfect example was with the honors English class. That's why I say it as a joke and example, because I wasn't even in the mindset that I could change something.
Yeah.
You know what I mean? Once I decided on something, it's within the system that you're in. You follow the guidelines and the rules and you complete. It's just very robotic in a way, right? A lot of rote memorization, that kind of stuff. I was introduced to a whole different system of educating myself with having choices and being able to think a little bit more critically about what I do, and why I want to do it, right? And that was one of the biggest differences. And so going through psychiatry, I was realizing that this is a field that is incredible. In the end, through various things, I decided on emergency medicine, but this field of being able to work with patients, with people really, on their well-being from a cognitive and emotional standpoint is something that was always an underlying thread with whatever I did. And it brought me full circle.
And that field really needs you. Unfortunately, that would have, because I mean, finding a psychiatrist, I hate to say this, but like that really tunes into the human being is very difficult to find. Like in terms of referring clients who are super vulnerable, dealing with depression, anxiety, there can often be like a very robotic person.
So I think, Maria, that was actually the one thing why I didn't decide to pursue psychiatry was my formal training experiences that I had in medical school. It's not that they were great experiences, but I think I was, at the time, not being able to look at the field of what I could do with it. I felt like it was a little too, in a way, focused on, pharmacology, and it was, and it makes sense because that's something you have to memorize, you have to learn, and the processes, and the ICD-10 codes and all of this, right? And diagnoses and criteria and all of that. It was a lot more focused on that than in general a therapeutic approach, right?
It's true.
And that's something that I understand I could have delved into more with training, but that's something that actually initially I was like, do I really want to practice this way? So of course I didn't see the whole field. You don't, and the field that you decide on, you really don't have an idea until you're in the routine of the field and grinding away and training, like residency and there afterwards. But I was realizing more and more, that's the one aspect that I really aspired to. Is the therapeutic aspect of it, right? And that's what came full circle with Dr. Yannick, Justin, was when we went separate residencies. I went to USC, he went to UCI, and then he did a fellowship training at Harvard. We kind of diverged for a minute. You're very busy in residency. We kind of kept in touch, but he had his life, I had my life. We came full circle actually after residency when we were practicing attendings. And
so when did you guys come up with this idea? Because I haven't heard the story about it. Like you guys together kind of said, we think we want to do a ketamine clinic.
I think it started all with just, we were always, he is very entrepreneur driven. He is much better at this than me. I am more of I like the therapeutic component and I like to delve into that. We both do, but he's just a lot more driven in that sense. And we were more and more realizing in our respective fields. He was more focusing, he's Euro board certified, so am I, but he's also a pain specialist certified at Harvard. He was more focusing on that field, practicing in a clinic. I was working in various ERs. We're focusing more and more realizing of what we miss about medicine, drawing it back to when we were, because we knew each other from the beginning of training. We knew each other from essentially, I think we would have met day one in our first lecture in the back of the hallway. We're like, there was like a meeting of med students before, like a little, pre get together before the first class. I'm like, oh, you're active, we were both climbing at the time and this and that and surfing. And we just got, you seem cool, everything. Like, we met in the back of the class. We're like, I remember you. Let's just hang out, And it went from there, like day one with another friend of ours, colleagues. But I think it went full circle when we were realizing how much we missed that aspect of medicine, especially in our respective fields where we felt like we couldn't focus on
like just in the last couple of years?
Mainly in the last like 3 or 4 years, really. In the last 4 years, since we've started to even generate the idea, was coming full circle when we reconnected. That was actually after I graduated in 2020 from residency or became an attending. Immediately, we just started to talk about it because we were realizing more and more how we missed that approach, being able to have a therapeutic alliance with the patient, whatever you're talking about.
Right.
I have to say, it happens more frequently than it doesn't. A lot of ER visits are driven by that. Of course, a lot of times there's an organic cause, but oftentimes it is truly like that therapeutic alliance. I mean, if you talk to patients, and I do all the time, what do you feel like, what do you feel like you need? Well, a lot of the times people just need that therapeutic alliance to be heard, to be felt, to be listened to.
Yeah.
And I was realizing more and more that in a current um, occupation that I have, as an ER physician and the environments that I work with, I really didn't have not only time, but even the mindset for
I bet, especially in the ER. I mean, you're just like constantly.
And then you also see everything kind of firsthand. The exacerbations of people's, ailments, psychiatric, you see firsthand.
Yeah.
And you realize how limited you are of what you can do.
So how did the ketamine come out of that?
That started more and more when we reconnected. We're talking basically about how we missed it so much.
Yeah.
And in that sense, we started to more and more talk about, because we were aware of, we work with ketamine quite a bit.
Oh, in the ER.
In the ER, we work with it because it's an analgesic and a sedative medication. And I've worked with it extensively. And when we reconvened, we were more and more talking about how can we address and prevent some of the things that we see. And lo and behold, with COVID, more and more psychiatric exacerbations.
Exactly.
How can we maybe do something differently? And both of us were familiar with the medication specifically. That's why we didn't delve into something else. Ketamine, I've used it,
Well, and he was using it in the pain clinic all the time.
Exactly. And we were more and more delving into how can we utilize this therapy, that there is more and more body of literature coming out.
Yeah, more evidence that it helps with depression.
Especially in prevention of what we feel like is very much preventable.
Yeah.
Whether it's an ER visits or the sequelae of something horrific happening, right?
Yeah. Well, I know Justin has said he would notice with the chronic pain people in particular,
Definitely.
There was always comorbidity with
100%.
Mental health. And then he would see that was getting better.
How can it not? Right? Like that's like one thing,
and then none of the traditional
isolation.
Approaches were really working.
I mean, we're realizing more and more that, with the current medical field, we're also more and more hyper-focused because we are hyper-specialized more and more.
Yeah.
So patient oftentimes does feel like they have been packaged.
Yes.
They have their systems. That's how we're even trained in medical school, to think in systems framework, right? Putting them together. But it's very difficult to then separate yourself from that line of thinking to look at anything quote unquote wholesomely, right?
Yeah.
So in that sense, like that's another thing that I feel like we were trying to also start to delve into. Can we, and we birthed the idea, lofty goals in the beginning. We started with ketamine-assisted psychotherapy because it started to answer a lot of our questions. How can we introduce something that addresses and prevents, as a kind of almost like a prophylactic treatment, that we can address and prevent a lot of these things? How can we focus more on the therapeutic side, augmented by medication, that we're starting to get a lot of body of literature that it actually works in an environment.
Yeah.
And then the lofty goal is also to really make it into like a really comprehensive clinic, focusing on, we've both been very active always, focusing on really starting to introduce the other things that work, healthy habits when it comes to diet, exercise, sleep habits.
We're all very holistic
and
with that.
And we're obviously we were episodes about that. But that's where we started to come up with the idea of how can we start introducing a solution in a lot more comprehensive manner that really we feel passionately about. And it comes back down to being able to just simply have that connection with the patient, which is very difficult to nurture in the environment that I've worked in before this.
I'm sure, because like you said, there's no time.
I mean, there are blips of it, but it's just nothing like what we were trying to create in the clinics. And that's how it was basically born, is to really start addressing that in a way that we feel really passionately about. With medication we're very familiar with now being able to also start delving into therapy that's growing, how we can augment the effects of the medication with appropriate therapy. So that's really how it was birthed, to really just try to make something more comprehensive instead of just chopping the patient up again into individual systems, and then most of the time they don't even know what's going on.
Yeah.
The providers themselves oftentimes have a
so it's been really rewarding, I'm sure. I mean, I know you're still working at the ER and you're still building your clinic. It's
of course, yeah, but it's been incredible in the sense, look, it's so, I can't compare them. The environments are so different in a way, right? But yes, there is that incredible, like, it's not even satisfaction, it's that deep, like, level of, oh my God, this is why I do this.
Yeah.
Is when something goes really right with a critical patient in the ER. But I can tell you that it's hard for me to say that, but it's almost, I feel like, been overshadowed. It's different. It's apples and oranges, but it's been overshadowed by the experiences I would have with patients in the clinic. Right. Oftentimes when they come out of their session and we're able to actually just speak and experience the journey they've had and start building on that. I mean, those have been, I have to say, that's why I do it, honestly. That's why I do it. You know that, Maria.
Well, right? I know that because you did it with me, and your presence was so powerful. Just those holding moments, the space and then helping me process.
I can't say enough about those moments, because was for me, it's like a child relearning again about life.
Yeah.
Because I learned so much. I learned about myself. I learned about humanity as is.
Yeah.
Unlike I've done in any other environment or with anything else I've done.
Yeah.
So in that sense, that's what really drives me, is being able to go through that with clients and see how they can reform.
Yeah.
And you, in a way, along with them, you know.
Yeah.
It's really that alliance has to be there in order for it to work.
Yeah. Well, I'm so grateful to have met you, Justin, because I mean, just to be able to collaborate in a field that needs the integration with people 100%. That get that and are also very attuned emotionally with themselves, but with others, you know, it's hard to find, honestly. And not to stereotype doctors, but they can often be, like you said, trained to be very rigid in the way that they treat. To some extent,
you're trained to do that.
Exactly. You know? And so the human side of it and the personal side of it is so critical. I mean, especially when we're dealing with mental health, because that's how I found you guys, because I was interviewing clinics going, I don't want to send a client to someone who's going to be a robot when they walk in and they're dealing with severe depression, you know? And so anyway, so grateful that we are able to do this together and that we partner with clients. It's been wonderful. And I think that's all we have for today, but I wanted everyone to meet Dr. Richter. He's amazing, David.
Thank you.
And we will look forward to seeing you next week at Catalyst for Healing. Definitely. All right. Have a good day.
Bye-bye.
Okay.